Hi, I'm Mark. I'm a paramedic here at Cetronia. This is Sarah. She's an EMT here at Cetronia. We're going to give you a quick overview of hands-only CPR. So it's important to provide CPR prior to an ambulance arrival to help circulate blood around in a person experiencing a cardiac arrest emergency, to basically keep their important brain, lung function going until we can get there with the ambulance. It's important to recognize this emergency immediately and immediately begin CPR while someone calls 911 and gets the ambulance there. So Sarah and I are going to give you a quick overview of CPR to help you get along able to do that. You're going to move and we're good. Right. So obviously we're in the back of an ambulance. It's probably not where you're going to find someone in cardiac arrest, but wherever you're at, the first thing to do is make sure that you and the patient are safe. So if they're collapsed in the middle of the street, you don't want to be in the middle of the street doing CPR. You want to move them to someplace safe. Watch out for other kind of hazards. So the first thing you're going to do is identify you have a possible person experiencing an emergency. You're going to shake and shout them to make sure they're not just sleeping. Okay, so a good strong shake, maybe yell, hey, hey, are you okay? Once you recognize that they are an emergency, direct someone to call 911 if there's other bystanders around to help you. Okay.
So you call 911.
All right. So now we're going to look to see that the person appears to be in distress. If they have no breathing, you don't see their chest going up and down, you don't hear air moving in and out of their mouth, or it's very ineffective, like gasping breaths, that person probably needs CPR. And don't worry, if they aren't in cardiac arrest, doing CPR on them won't hurt them. We'd rather have you start CPR on someone that didn't need it than to not start it on someone who does need it. So after we shake and shout, we called for help. Now we're going to look at where we do our compressions. You may have learned from CPR in the past about opening the airway with a head tilt chin lift, giving breaths, things like that. What's more important is to get blood circulating around. There's enough oxygen in your bloodstream that by doing compressions only, you do get oxygenated blood moving around the body. And actually with the compressions of the chest, as their chest goes up and down, when you do that, air actually does get pulled in and out. So if you have concerns about, providing mouth-to-mouth resuscitation on somebody that you don't know for disease transmission, what's more important is these compressions. So the first thing we need to do, or the next thing we need to do, you can edit that later. The next thing we need to do is start compression. So we look for landmarks on the patient's chest. Basically the lower half of the sternum, so that's the bone in the middle of your chest. You're going to place the heel of one hand over that bone and put your second hand over top of that. Interlock your fingers, trying to keep the heel of your hand on that bone the whole time. And then we're going to start compressing the chest to a depth about 1/3 the patient's chest. So whether they're, a younger person, usually we look at someone over the age of 8 or so, as an adult and up, that's the depth you're going to go. So we're going to do compressions. We're going to push straight down, as you see Sarah doing, compressing that chest. When we get into the full-on cycle here, you're going to do 30 compressions at a shot here. And that rate is basically 1 compression down, 1 compression up, as you see Sarah, to the rate of about 30 a minute or so. If it helps you, you can count out loud, getting up to that 30. When you get to that 30, you're going to stop and pause and see if the patient is breathing or not. And then if they're not, you're going to go ahead and keep resuming CPR. Those compressions, again, at a rate of 30 compressions. And then a couple seconds pause, look for breathing, and then continue until either you're too tired to continue, someone else takes over for you, or the ambulance arrives.
9:30.
Good?
Good.